An increasing number of elderly have decided to spend their final years at home instead of a nursing facility. With the population aging, that is creating a boom in private home health care companies. For most Oklahomans, state services are available to help them stay at home.
America is aging. Over the last 3 decades, the number of people over the age of 90 has nearly tripled. And while many people in their 80s or 90s face health issues, the desire to live out those last years at home is stronger than ever and is more possible than ever. Private home care companies have flourished as the demand for home health care services increases. 84-year-old Vestina Ruffin is living in the house her family has called home for more than 50 years, in large part because of a private home care company. Lisa Edmonds moved back into her family home as her parents aged, knowing they wanted to stay there and that someone was going to have to help to make that happen.
So she is happy to be here. She really is. She doesn't show as much emotion anymore, but every now and then we do get it out of her, especially those of us who are around her more.
A long-term care insurance policy helps pay the cost of hiring the private company, Home Instead Senior Care. Edmonds says she also gets help from a large support group of family and friends.
In fact, the other women who helped me, everyone's kind of helped out. They've all kind of juggled their schedules to sort of make it work. And that's included me to help out on certain nights when they can't come. And my kids help a little bit, when they can.
Charlene Burrell showed up at the Edmonds home 7 years ago, among the first home health care workers to help care for Lisa's mother. Now she is in management and hires certified nursing aides like Margaret, who is in the Edmonds home daily to do things that are focused on quality of life. Charlene says finding good people to hire is not easy, but they are out there.
Be reliable, be able to perform personal care, hands-on assistance with warmth and love and patience.
A starting salary for private care nursing aides is $9.25 an hour, but actual costs for the services can run double that. There is also 24-hour-a-day, 7-day-a-week care, which runs around $240 a day. Costs that Lisa Edmonds knows many Oklahomans cannot afford.
There are a lot of other people in my generation who are caring for parents who truly are the ones doing the work. I mean, they're working and then they're trying to figure out when to get home to, slide in an hour here or there, or to the nursing home to check in on their mom or dad. And, I have the luxury of having her here.
Living out those final years at home can mean tremendous workloads falling on the shoulders of 1 or 2 family members. But there are state services that do help. For 20 years, the Advantage program has helped more than 74,000 Oklahomans stay at home.
The Advantage program is an amazing program for the state of Oklahoma, and we really make an impact on people's lives every day.
Megan Haddock is Medicaid Services Director in the Aging Services Division of DHS. Now, more than 20,000 Oklahomans a year avoid going to a nursing home because of the Advantage program.
Home care to meals, to laundry, bathing, skilled nursing. We also have assisted living facilities throughout the state. And we also offer anything that helps the person stay at home as long as their health and safety needs are met to avoid going into the nursing home.
Funding for the program is always an issue, but Haddock says lawmakers have seen the financial wisdom of keeping it going.
And also the impact it has on the state budget, because Advantage saves the state about $300 million each year to allow people to stay at home rather than a nursing home.
To sign up for the Advantage program, contact any DHS county office. People living in a nursing home, elderly or disabled, likely also qualify for a program at the Healthcare Authority that helps them move back home. Erin Jackson is the project director for Living Choice, a program funded through Medicaid that also provides the services necessary to help people move back home.
Case management, personal care, home delivered meals, vision services, dental services. And we also have a one-time allotment of money that can go towards the establishment of household items.
Virtually anyone in a nursing home under Medicaid can qualify for Living Choice, a state program that requires involvement of family and friends.
A family, a friend, a loved one, even someone from the church that can come and assist them.
And like the Advantage program, Living Choice is a money saver for state government.
We're looking at a cost of about $4,000 to live in the nursing home. Compare that to $1,000 per member per month in the community. It is a huge savings, so we're definitely saving the state a lot of money.
More than 460 people have used Living Choice to move back home. Erin Jackson says new applications come in nearly every day.
Especially with Thanksgiving and Christmas coming around the corner, a lot of people want to be able to return home to their loved ones.
Those interested in the Living Choice program can sign up by calling the Healthcare Authority at 888-287-2443 or going to its website, livingchoice.org. As the population ages and the elderly live even longer, long-term care insurance has become more necessary. Lisa Edmonds says having conversations about the reality of the future with aging loved ones is also needed.
But I do think it's important to open that line of communication. You have to be somewhat careful about how you go about it to not hurt them or be too invasive and be sensitive, but it really does have to be done. I never would have expected my mom to be in this situation, but I've loved having her home.
Shannon Rich-Romero with Home Instead Senior Care says they hear daily from people who are desperate to keep someone they love at home.
Our office gets calls every day from people crying because they don't know what to do with mom or dad or their grandparents. And so people my age and older and even younger are taking care of family members, and that's very stressful.
So while private home care can get expensive, help is available to keep aging Oklahomans at home where they really want to be.
And know that you have a choice, know what your options are.